dear students. Welcome back to my YouTube channel Physiology Learning. Today we are continuing with our cardiovascular system and this is a series of lecture and in today's lecture we are going to see about the heart sounds. So in this video we'll be discussing about the heart sounds. In the previous cardiac cycle videos itself I have introduced like where all the sounds will happen, but this will be a detailed discussion of the various heart sounds. So let's get into the topic. So first a few questions to begin with. You will continuously, as you progress through your MBBS career, you will keep on hearing the term that is a murmur. So what is a murmur? We'll try to understand that. So then apart from the normal heart sounds, whenever there is some abnormality, abnormal sounds which are created due to turbulence of the blood flow, that it might be due to a valvular obstruction or it might be due to a failure of the valve, like it could be a regurgitation phenomena also. So that is murmur. So these are abnormal sounds which are created due to the turbulence apart from the natural heart sounds. Then there is a question that third heart sound, I will introduce the concept like what is the third and fourth heart sound, can it be heard physiologically, and why is the second heart sound? We will come to know that it is shorter in duration and as well as it has the high frequency of vibrations. So why is it that so for the second heart sound? We will discuss that also. So coming to the heart sounds, first we have to understand why the heart sounds are produced, like what is the basic phenomena behind these heart sounds. So what is the reason for this heart sound? All of us know that it is the closure of the valves, either it is the AV valve, atrioventricular valve closure, or the seminal valve closure which is creating the heart sound. But right now this is the previous reason which was quoted, still it is valid, you can give it to the examiners, but sometimes if they ask you very specifically, is there any other reason for the heart sounds? Because right now the concept is whenever there is a closure of the valve, always we think that whenever we touch something it is going to create a sound, but now they have understood that the valves have so much of cushioning effect, the valves are having too much of cushioning, so it is not only their closure which is creating a sound. Apart from that, what happens is there is a tautness of the chorda tendineae. So this chorda tendineae keeps the attachment of the valves. So they are becoming very taut, and what they will do is they will create some sort of vibration when these valves are shut. So the valves are shut and this is becoming taut. So what is happening is the blood inside is having some vibration. So that is creating the vibration which is leading on to the sound. So the latest concept, it is not that just the closure of the valve which is creating sound, it is the tautness of the chordae tendineae which is creating a sound. As well as the vibrations are created, so once it is taut and the blood keeps on moving back and forth. So because of that, the heart sound is produced. So the latest reasons are these two, which is creating the heart sound. Now let's try to understand what are the various different heart sounds. Primarily, there are two heart sounds which all of us know, which is lub and dub. Now this concept of lub dub is also not used, but for a general understanding, we can still have it. So this lub is called as the S1 heart sound and dub is called as the S2 heart sound. Apart from these two, there can be two other heart sounds, that is the S3 and S4. So we will discuss most importantly the S1 and S2 and a few points about the S3 and S4 also. So first coming to the heart sounds, they are generally classified as lub and dub. So the lub is referred as the S1 sound and the dub is the S2 sound. So here I have written the characteristic features of them and what are their significance. So S1 is created due to the closure of which valves? It is created due to the closure of AV valves. That is the atrioventricular valves. That is nothing but our mitral and tricuspid. So these are the two valves which is creating the S1 sound. Whereas which indicates the S2 sound? The aortic and pulmonary valves. So these valves are also called as semi-lunar valves. Semi-lunar valves. And what is the duration? The S1 is usually longer. It's not that long. It is longer than the S2. It is longer. It is around 0.12 seconds to 0.15 seconds. Whereas the S2 is a little shorter. It is around 0.10 to 0.11 seconds. So this is the duration. And why S2 is shorter whereas the S1 is longer? The reason for this is the semilunar valves, they are very taut. They are very taut. So what will happen? Because of their tautness, they close very fast and making the duration shorter. Now coming to the frequency, the S1 is around 25 to 45 hertz, whereas the S2, the frequency is also higher. The frequency is around 50 hertz, more than 50 hertz also sometimes. Why is it so? The frequency is high because whenever the valve, let's take an example of aorta, it is taut, so it shuts faster. That is one reason why it's shorter. And next thing is, whenever it is shut, the sound is created because of the arterial walls. The arterial walls act as a tensing board. So basically here the valve is closed, and after that the arterial wall, it is acting as a tensing board. Whereas in case of S1, it is the ventricular chamber which is acting as a chamber to produce a sound. Here the arterial walls has higher elastic coefficient. Higher elastic coefficient. And because of this higher elastic coefficient, what is happening? The sounding chamber is having a high elastic coefficient. So because of that, the frequency of vibrations which are produced in them is also higher. And especially the aorta is already under a high pressure system. So aorta, if you take, it is already under high pressure system. So the waves generated are much faster. The frequency is more. So these are the reasons why the second heart sound is shorter, as well as it is having high frequency. So after S1, what happens in the heart? AV valve closes whenever the ventricle starts to contract. Whenever the ventricle starts to contract, we call it as a systole. So it marks the beginning of systole. It marks the beginning of systole. Whereas the S2, it signifies the end of systole. End of systole. So once all the blood is being pumped out, what will happen? The aorta will close and it marks the end of systole or beginning of diastole. Both are same. It is a, we need to know which is S1 and S2 so that we can predict like what type of murmur the patient is having. So that I will tell you in a short while how it is done. Why S2 is louder? Because it is a taut valve and has a higher frequency, because here the vibrating chamber is the arterial walls. That is the reason for S2 being louder and having higher frequency. So whenever you place your stethoscope in your first year MBBS, obviously all of you will be able to appreciate two sounds. But based on these features, like it is longer, shorter, or higher frequency, lower frequency, because based on these features, it will not be identifiable that which is S1 and S2. Whenever you place a step, you are going to hear two different sounds, S1 and S2. It is highly unlikely that you can identify which is S1 and S2. But clinically, there is an easier way, and that is the way to identify which is S1 and S2. So after S1, what happens? The systole starting to happen in isovolumic contraction, the S1 is here. Whenever it is further keeping on contracting, there will be a systole. And whenever there is a systole, the blood is pumped. The blood is being pumped into the valves. Let's take the aorta. So whenever it goes to the aorta, it goes to the circulation. So the S1 sound, it will be corresponding with the pulse. So uncommonly that the pulse used here is the carotid pulse. So what you have to do is you have to place the stethoscope with one hand, and using your other hand you will place it on the carotid of the person whom you are doing an auscultation of the heart sound. So whichever sound, you are hearing a sound and you are feeling the pulse. When these two coincide with each other, that is the marking of S1. So S1 coincides with the carotid pulse, whereas you will hear another sound which is not coinciding with the carotid pulse. So why are you stressing on this? What is the importance of identifying an S1 and S2? It has a good clinical significance, because after S1, what is going to happen? There is going to be S2. Again, the next cycle will have S1. So between S1 and S2, what is the activity that is going on? The activity that is going on is the systole. Between S2 and the next S1, the activity that is going on is the diastole. This is logical. Between S1 and S2, there is a systole. Between the S2 and the next S1, there is going to be diastole. What is its importance? Suppose if you are hearing a murmur, let's assume the patient, we are auscultating and we are hearing a murmur at this point. Let's take at this point there is some murmur or whooshing sound. So this is happening during a diastole. So this is happening during a diastole, and that will help us to identify. Suppose you are palpating it and S1 is heard, then there is no murmur, then S2 is heard, then after that the murmur is heard before the next S1. So this will help us to identify that it is a diastolic murmur. And in our example, it is heard during the mid diastole. It is a mid diastolic murmur. And this is one of the commonest murmur that is heard, and it happens in a condition called as mitral stenosis. Mitral stenosis. So if it happens between S1 and S2, it is called as systolic murmur. Whenever it happens between S2 and the next S1, it is called as a diastolic murmur. This mid-diastolic murmur is a characteristic feature of mitral stenosis. This will help us to understand murmurs. So why in mitral stenosis it's happening? Suppose this is the valve here and this is the valve here. So this valve between the atria and the ventricle, here we have the mitral valve. Suppose this valve is having a stenosis. So what will happen whenever the ventricle is going for a relaxation and this valve is opened, through this stenosed valve the blood is going to move. Now ventricle is in which phase? The ventricle is in the diastolic phase. So whenever it is moving through a stenosed valve, stenosed means there is some obstruction. Whenever it is moving through a stenosed valve, we are going to hear a murmur, that is a diastolic murmur. This is for the mitral valve. So that is how you can identify whether which valve is affected. If you are hearing this type of mid diastolic murmur, there is some activity which is during the diastole that is getting affected. Whenever there is a diastole, the blood is being filled from the atria to the ventricle. So that valve might be affected, and it is the mitral valve which is in between them. So just by hearing the sound, we are able to identify which valve is affected. The same goes with aortic regurgitation and so many other murmurs. Here I don't want to stress about the murmur part. Here we are just going to understand what is the significance of S1 and S2, which is indicating the diastole and the systolic period in S1 and S2. So that is the importance of identifying S1 and S2 clinically. This part is very, very important. Then coming to the other two heart sounds, the S3 and S4. S3 we already saw in the cardiac cycle itself during the phase of rapid filling phase. The filling phase is of three duration: rapid filling phase, slow filling phase, and filling due to atrial contraction. This we have already seen it in the cardiac cycle area, cardiac cycle chapter. So this rapid filling phase, whenever the blood is having a hyperdynamic circulation. Suppose you have a ventricle here and the atria is here. So in the rapid filling phase, the blood is gushing from the atria to the ventricle. So at that time, it is creating some vibrations in the ventricle which can be heard as S3 sound. Normally, it is not heard through a stethoscope. Sometimes it can be heard through a stethoscope in case of hyperdynamic circulations. So naturally, we have this kind of hyperdynamic circulation in few of the physiological conditions also. So S3 can be heard physiologically also, but S4 is always pathological, which we are going to discuss. So in case of pregnancy, it can be heard. In athletes also it can be heard, and sometimes in children. So in all these conditions, the S3 can be physiologically heard. Coming to the S4, it is the sound that is heard whenever there is a ventricular filling due to atrial contraction. Whenever the ventricle is getting filled due to atrial contraction, it might create some sort of sound, that is the S4. And whenever the atria is contracting and it is sending the blood, there might be a slight sound heard, and this is most of the times pathological in nature. So it is mostly pathological. And S3 and S4, usually it cannot be heard using a stethoscope, but in the recording of a phonocardiogram, the sound is very, very low in intensity. That's why it cannot be heard through a stethoscope, but it can be recorded through a device called as phonocardiogram. So phonocardiogram is a device which will be recording the sound intensity and it will be creating the wave pattern of the sounds. So whenever you are using a phonocardiogram to record it, as you can see here, this is a continuation of the cardiac cycle only. There are two periods, one is the systole and the diastole. Systole means blood is being ejected out of the ventricle, whereas diastole means it is a relaxation period. So whenever the AV valve is closed, the systole is going to begin, which is going to create the S1 heart sound. And after that, whenever the semilunar valve is closed, we are going to create the S sound. So after that, the diastole is going to happen. Diastole is going to happen in three phases: 1, 2, 3. As you can see here, towards the end of the first phase, that is a rapid filling phase, we are hearing the third heart sound. Where will be the fourth heart sound? Here they have not drawn it. So the fourth heart sound will be somewhere here. In this region, we will be hearing the fourth heart sound. So for your exams and Viva, if they ask a question on heart sound, you have to mention about all four heart sounds. But during the Viva, you can still say that S1 and S2. If the examiner specifically asks what are the other types of sounds which can be heard, then you can mention about these two additional heart sounds, which are not generally heard using a stethoscope, but it can be recorded using a phonocardiogram. I hope it's clear. Thank you for watching the video. If you have any doubts, please do drop in the comment section. I'll be happy to assist and make a new video. Thank you for watching the video. We'll see you in the next video.